Joining us next, Baltimore City Health Commissioner Dr. Lena Wen and Jackie Judd, special correspondent for PBS NewsHour.
Good morning, everyone. And thank you to Aspen for including me in this important conversation. I was at an Aspen event this past summer, and a speaker there said you can learn more about an individual's health status and health risks from their zip code more than you can learn. You can't hear me? Anybody want to turn my mic on? Great. Hello again. Should I start all over? Okay. Good morning.
Good morning.
And thank you to Aspen once again for including me in this important conversation. I was saying that at an Aspen event this past summer, a speaker there said that you can learn and understand more about a person's health status and health risks from their zip code than you can learn from their genetic code. In other words, where people live matters a lot. And Dr. Lena Wen is very much a practitioner of that belief, one of the leading voices in the nation. You have seen that played out through much of your career, Lena. Early on, as a third-year medical student, you encountered a woman who had missed several kidney dialysis sessions. And I'd like you to share that with the audience because I think it's instructive in terms of the zip code versus the genetic code, and also the pushback that you got from your attending. What happened? Is yours going to work?
Is this working or should I? Oh, it is. Okay, excellent. So first of all, good morning and thank you. It's very difficult to follow Darren and Heather and Gwen, but Jackie and I will try our best. And you know, for me, as a physician, we encounter a lot of patients. This is a patient that I encountered when I was a medical student who had diabetes, kidney failure, came in all the time needing dialysis. Just like we also see a lot of patients coming in over and over again with asthma attacks or heart disease or whatever. And we always give this patient dialysis, we give them medications, we know how to treat that medical problem. I asked the question of why she missed her dialysis. And I was told by my attending physician, the supervisor at the time, that you should watch out for what questions you're asking. Because if you don't know how to intervene, what's the point of opening Pandora's box? And that's something that I've carried through in my training of if you don't know what to do, what's the point of doing it? And yet, you know, in Baltimore, I chair a committee called the Child Fatality Review Committee, where we look at every case of child death in the city, which is horrible. I mean, you never forget any case of a child who died. And you know, here around the table, we have these attorney's office and police and health and DSS and schools and everything. And one thing we see in common with every case of a child who died in the city is that that child has almost always been touched by every single one of our services. Not only that child, but also their parents have been touched multiple times by all of these services. Their files this big for every child. And the question is if we don't intervene, whose job is it?
And just as a postscript to that opening anecdote, the reason the woman had missed her dialysis sessions was because her son was the person who drove her to the clinic and he had been arrested, right? So you can't approach health in these silos that we have traditionally done. You have overseen, implemented many programs in Baltimore City that take this approach. And I'm wondering if you can, what are the guiding principles of those programs before we do a deep dive into some of those programs?
One of our guiding principles that goes very much along the lines of what the two previous panelists said is that we believe in starting as early as possible. You know, there's a program we have in Baltimore City, and you know, you all have seen the news about Baltimore. You've seen bad things coming out of the city, right? It looks like the city is literally burning down. But I want to tell you a good story. Back in 2009, we had the fourth worst infant mortality rate in the country. If you asked everybody at the time why that was the case, they would have said it's because of lack of resources. But actually, there were a lot of resources. They were just going to over 100 different programs. There were nonprofits, there were sororities, there were insurers and hospitals, and everybody was doing different things to combat infant mortality. Instead of saying this is too difficult, we have to overcome too many silos, instead, the city health department and the city said, let's get everyone together. And we formed a campaign called Be More for Healthy Babies, which involves home visiting for pregnant first-time teen moms and involves hiring community health workers to carry out the message, really going to where people are, hiring the most credible messengers to do that job, and also starting as early as possible to intervene at the point that's the most necessary, that 0 to 5 age. As a result, we have now the lowest infant mortality rate the city has ever had. We had a 32% reduction in teen birth rates and a 50% reduction in the number of sleep-related infant mortalities, which is remarkable. And that's a success for our city, but it also illustrates one of our guiding principles, which is that we have to start as early as possible, and that we have to go to where people are.
And what does that expression mean, go to where people are?
With the Affordable Care Act, we have had a lot of critics of the way that we do things in the city, because people have said, why do you still need to provide direct clinical care? You know, we have two safety net clinics where we serve 60,000 individuals in the city. And we also have health suites with a nurse or nurse aide or nurse practitioner in every one of our 189 public schools to serve students. And we've heard a lot of critics say, now that everybody has health insurance or can have health insurance, why can't people just all get a primary care doctor? That would be great if we're Bethesda or Chevy Chase or whatever areas you all come from. But we have thousands of children in our city who are homeless. And our choice is either on the first day of school to turn away 5,000 kids because they don't have their immunizations, or it's to say, we will deliver care in the schools. Our choice is either to say, we'll send you home and send you to an ER and have you have the child wait for the whole day to be seen for their asthma and have their caregiver miss work, or it's to say, we're going to provide care in your schools because that's where you are. And I'll give you one more example of this because I think this also illustrates our principle of hiring credible messengers to go out in the community. Everywhere in the country, we're seeing the spike in violence, and definitely in the case in Baltimore City as well. We have a program called Safe Streets, which is based on a national model called Cure Violence. And the idea is that we hire recently returned citizens, many of whom used to be gang members and drug dealers, to serve in the streets of Baltimore. They walk the streets of Baltimore. They mediate conflict where it occurs. And it sounds a little bit hokey, but think about it this way. If I walk the streets of West Baltimore, and I go up to two people who look like they're in the middle of a fight, and I try to get them to drop their weapons, probably not going to be the most effective. But these are individuals who are known as the leaders in their communities, who've been there. And last year, even though our Safe Streets employees only cover 1.5 square miles in the city, they mediated 880 conflicts. 80% of those conflicts were deemed to be likely or very likely to result in gun violence. Now, I don't know how you even quantify this. Right, I think it's remarkable, but I don't even know how you quantify this in terms of number of lives saved or in terms of injuries or cost. But it's not only an economic imperative, as was mentioned, but this is also a proven intervention that we need to replicate.
And I know one of your guiding principles is that people in vulnerable communities need to see results now, tomorrow, next week, not in the next decade. Is what you've just described about Safe Streets an example of that? And does it make a difference in how people in the community view the efforts of your health department?
It's a really good question, and this is what we struggle with all the time, that the trajectory of public health is so long. Right? I mean, we're talking about improving life expectancy, reducing smoking rates and obesity rates. And if I went to our community meetings and said to people, my goal is to increase life expectancy, how are we supposed to measure this in a tangible way? How do people know to hold us accountable? So what we have to do is to set short-term goals and metrics on the way there. So I'll give you an example. Addiction is a huge problem in our city, just like it is across the country. But speaking about this whole justice issue that was mentioned in the last panel, I heard someone say the other day about addiction, if you are wealthy and you're insured, addiction is a disease, right? You can go off and people will send you to some clinic and you come back and you're battling a disease and you write about it in your memoirs and it's like you've battled something. If you're poor and uninsured, addiction is a moral failing. It lands you in jail. Do you know that in our jails, 8 out of 10 individuals have a substance use disorder or have used illegal substances in the last 30 days? 4 out of 10 of our people in our jails in Baltimore City have a diagnosed mental illness. We are incarcerating people with a disease. And then we're sending them out onto the streets with no more resources or information or connections than they have. And how are we surprised that they then potentially wreak havoc in their communities and then are back? And we're not supporting our families, we're not doing this. But if we just said to our community, our goal is to eliminate addiction, people are going to look at me and say, that's a great pipe dream, but how is this actually helping me today? In our city, we have more people last year who died from drug and alcohol overdose than died from homicide. More people die from overdose than die from homicide, and that's a problem that's affecting everyone. I can go into a room, any of our community centers or senior centers, if I say to people, how many of you know someone who overdosed, every single person will raise their hands. If I say how many people have seen someone who has watched somebody overdose in front of them, they'll say they've seen it. And so what we're doing as our short-term metric on the way to that long-term goal of addiction, of reducing addiction, is that we have rolled out a comprehensive overdose prevention plan. We've passed legislation so that I'm now the prescriber for 620,000 people in Baltimore City, all of our citizens, for the overdose antidote medication. And we've trained over 6,000 people this year alone, including our police officers, who for the first time last month, 4 of our police officers saved 4 people's lives, which is also helping to change that mentality in policing from we're doing something to people to we're trying to save lives.
Lena, as I was preparing for this and I Googled your name, a press release came up from Baltimore City, and it was the announcement of a new federal grant related to trying to contain violence and change the trend there. And I thought, why would a health commissioner's name be attached to that? But in fact, yours was. And it's kind of emblematic of how you approach the subject of health status and risks. And I'm wondering how you deal with the pushback that you must inevitably get, especially after a summer that Baltimore has had, the death of Freddie Gray and the subsequent demonstrations. How do you deal with the pushback from officials who say, we need to work in the traditional way and hit the communities hard?
It's tempting to look at what happened to our city in April as violence, right? It's easy to look at that and say there are bad people who are doing violent things and now we need to deal with that as a criminal justice issue. But if we look just one step deeper, and this is what we constantly fight to do in health, we have to look one step deeper, we have to go further upstream. We look one step deeper at violence and we find trauma. Those go hand in hand. I mean, trauma is grief that's unexpressed. It's anger that's unexpressed. It's undiagnosed, untreated mental illness and drug addiction and all these things that people in our community face who never have a seatbelt, right? They never have a safety cushion. And this is what happens. They have this trauma that never gets treated that then results in violence. And then we look one step deeper, and this is what we have to do in health. This is the argument that we make, that we look one step deeper behind trauma. We go way upstream in health, and we realize that we have to make those investments early on. That public health is our best opportunity to level that playing field of inequality that we were talking about. I think there's also another part of what we do, and we can do this from a public health perspective, perhaps easier than other disciplines. Because we're scientists, we're doctors, we use facts on our side. We're also able to call it as it is. And we're able to say, look at our facts, right? In our city of 620,000 people, there are 73,000 arrests made every year. Most of these arrests are for drug offenses. And you heard the statistics that I mentioned earlier about how many people we're incarcerating with drug and mental health issues. And we can say, let's look at that. Let's call it as it is. Let's call it and say that our city is where we are and other cities are where you are too because of our historical policies of structural poverty and systemic racism. Let's call it and say that racism is a public health issue, that violence is a public health issue.
A few days ago, the city announced that there had been 300 homicides in Baltimore City this year, which represents a spike in that number. Does that give you pause about what needs to be done next and whether all of the programs you oversee and many others in Baltimore City really are being as effective as they need to be?
It's hard in the rate of things that don't, or in light of things that don't look like it's going in the right direction, to keep on pushing that way, right? Because it's tempting to say, things are not working, and so let's start over. That's why we have our principle of let's have our long-term plan. And our long-term plan is one that results in the reduced infant mortality, in the reduced gun violence, all these things. But we have to have short-term metrics that we're hitting. But those short-term metrics are what are determined with the community. And I want to give you an example of this because I think community engagement is something that we feel very strongly about in health, but it does tie to your point about how can we show our community that we're doing something that's effective. Right after the unrest, and we're talking about the day after the unrest, we heard that in the health department, we heard that it wasn't just a matter of getting people safely to hospitals. That's what we thought our job was. If you asked me 6 months, well, maybe not 6 months ago, 8 months ago, what was the role of the health department in civil unrest? I'm not sure that I would have known because I wouldn't have thought about it, right? Maybe it was getting people to hospitals or getting people to dialysis or chemotherapy, but we heard that 13 of our pharmacies had burned down or were looted or were closed, and that there were hundreds of people who were without access to their life-saving medications, which at the time we were calling around to these pharmacy chains and owners, and they were saying to us, they probably might not say that now, but they were saying to us at the time, what's the big deal? Because in our city, there are dozens of other pharmacies. Why can't you just go 6 blocks away to another pharmacy? Okay, well, I can do it as a doctor. I can call my prescriptions from Walgreens and transfer to CVS. That's fine. But I'm not sure that most people can. Or maybe we who are able-bodied and have the privilege can walk or take an Uber or whatever and go somewhere else. But what if you're 80 years old in a wheelchair on oxygen and you're out of your insulin, you're out of your blood thinners? This is what we heard in our communities. And so we ended up putting together a 24/7 prescription access program where we would deliver medications to people and figure out how to get medications and food. 1 out of 3 African Americans in Baltimore City lives in a food desert without access to fresh fruits and vegetables. So they use their CVS as a grocery store, which is unfortunate. That's not the way it should be, but that is what happened. So we set up shuttles and food delivery services, but we knew that we had to get that information to our residents. And so we had flyers, we got staff and volunteers, hundreds of them across the city, going to churches and senior buildings to get the message out. People asked us 2 questions, and I want you to imagine this is 1 or 2 days after the unrest. Okay, where it looks like the world is burning down. This is right after the unrest. People had 2 questions. The first question was, what candidate is this for? They really thought that the day after the unrest that we were out there campaigning for a candidate. Okay. Second question was, what survey is this? Because I think I filled out a survey last week. And these are not people who are trying to be snarky or mean or whatever, but they were telling us that they see us being there for us and not being there for them. And so in the wake of the unrest, while we're explaining all the time that we have to look upstream, we have to look at these issues like life expectancy and infant mortality, we're also saying, help us define the metrics that you think are important. So even if we can't solve violent crime, what if we can improve food access? What if we can reduce overdose deaths? What are those metrics that we can hit but that we decide together with the community's input.
And this issue of short-term versus long-term results, I would ask you as a final question, and our 20 minutes have really gone fast. In 5 years, whether or not you're there, still in Baltimore, in 5 years, what would you consider a success of some of the programs that we've heard you speak about this morning?
What we would consider to be a success threefold. The first is that we want to look at the successes that we've had in the city, use these same principles, and expand them. So we know that our Be More for Healthy Babies, our infant mortality reduction program, has been successful. Now we are rolling out a comprehensive youth health and wellness campaign, using these same principles of collective impact, breaking down silos, and constant evaluation, and talking about our successes. So that's one. The second is, I would find it to be a success if we're able to convince everyone that what we need to do is to look upstream and to specifically address mental health and addiction, because those are key issues facing our city. So we're looking to have a 24/7 ER for addiction and mental health. We just started having a 24/7 phone line where anybody can call to find a crisis counselor or information for mental health and substance abuse. I want for Baltimore not only to be the Baltimore of The Wire and to be the heroin capital, I want it to be now known as the recovery capital of the country. And my third goal that I would consider to be successful is that we in public health, I went into the ER because for us in the ER, just like for all medicine, every life matters. And we want to preserve the dignity and humanity of everyone. And so it's this idea of caring for the most vulnerable, leaving nobody behind. I want for everyone in our city to adopt that and see us as a city that is rising above whatever happened, to see us as really being at the forefront, the innovators, the catalyst for the changes that ideally will happen across the country. I do really believe that health is a great framework for us to think about these broader issues of injustice, and I'm optimistic that we can use public health as a critical social justice tool.
And that's the final word. Thank you all. Thank you, Dr. Wen, so much.